The science of human factors gives us much to celebrate about being human. In the context of healthcare, we are still the only truly intelligent components of our system of work. We are able to undertake complex reasoning, coordinate our activities in diverse multidisciplinary teams, and demonstrate empathy and care for our patients and consumers who may be vulnerable or gravely ill. However, as humans, we also have our inherent limitations, and our performance can never be expected to be entirely perfect. We suffer fatigue, we forget things, we make errors in judgment, and we don't always communicate as well as we would hope. We explore some of these issues in a separate video dedicated to human factors in patient safety. A truly safe system is one that expects and anticipates the errors that come naturally to us as humans. To paraphrase Professor James Reason, one of the gurus of system safety, designing an error-tolerant system enables our good people to be excellent. The idea of an error-tolerant system can easily be seen in the design of everyday technologies. Take, for instance, the typical family car and the common error of forgetting to turn off your headlights. A typical car from the 1970s was not error tolerant. If you forgot to turn off your headlights, you could expect to return to a car with a flat battery. One simple error that is both common and easily foreseeable would lead to an adverse event. These days, a typical car is designed with the error in mind, either through a warning tone that you've left your lights on, or even better, automatically turning on and off your lights for you. Cars are now much better designed. The simple error no longer results in an adverse event. The system is error tolerant. In healthcare, we need to adopt the same sort of thinking in our clinical incident investigations and in our safety and quality initiatives. Recommending more training so people do the correct thing more frequently, or reminding staff of the correct procedure so that there are no excuses to get it wrong, are old school strategies that have not really done well in the test of time. We need to dig deeper and understand why errors are made and the error-producing conditions in our systems of work that give rise to those errors. Streamlining and simplifying processes, taking out unnecessary steps, better managing workload and fatigue, providing useful cognitive aids and checklists, and redesigning the tools and technology we use are all more productive strategies from a quality and safety perspective. If we look around our workplaces, we can already see elements of error-tolerant design, from the alarm on a patient monitor, or electronic charting to help us discern subtle deterioration in a patient's condition, to automatic taps and doors to assist with infection control, to colour-coded connectors, tubes and syringes. There are lots of examples of error-tolerant design already. The more we move away from weak administrative controls, such as training reminders and threats of performance management, and invest in constant improvements in the design of our environments, equipment, processes and systems, the quicker we will achieve effective and sustainable improvements in quality and safety. At the end of the day, making what we do tolerant to human error is not about oversimplifying things or replacing humans with technological solutions. It's about being honest about our limitations and all the time celebrating our strengths. Error-tolerant design frees us up as humans to be great at what we do best, whilst protecting us from the things we know can easily go wrong.